Hello, my name is Deb Allard. I'm a family physician. I previously practiced for 24 years in Two Harbors, Minnesota. I am honored to tell you about my experience of working in New Zealand, initially in 2015, and then again each year, 2016, 17, and 18. My motivation for wanting to work in New Zealand was very strong, as our son had graduated from a New Zealand university and then found his lovely wife, and then eventually they had two children. And so my husband and I wanted to spend some extended time with them. I found out very quickly how complicated it is to practice in another country, but a fellow physician friend had told me about New Zealand locums and was so enthusiastic about it. I contacted them, and they were just incredibly helpful. They helped me find a position about 45 minutes from Christchurch, where my son was living, and they helped me with all the paperwork, made it actually easy, and they also helped me negotiate my contract, which was a wonderful thing. As far as the differences in practicing in New Zealand versus the United States, well, 99% of medicine is medicine. The rest, there are formulary differences, but you have access to their formulary and significant help with figuring out what is the appropriate medication. They also have a very nice EMR, which ran circles around the one I had been using, and it has protocols for not only preventative care but many acute situations. The physician notes are much more succinct in New Zealand, and I found that you really don't need a full review of systems on every patient. At our clinic that I was at, we had between 4 and 5 physicians most times. We had different medical students coming in. We had very skilled nurses that did a lot of the simple suturing and biopsy work, as well as much of the routine nursing care. As far as the cultural aspects of practicing in New Zealand, that was just a joy. I found the people were very welcoming. In my practice, they couldn't have been nicer. They couldn't have been more helpful, more grateful for my presence with them. They taught me enormously. As far as the cultural differences, just in general, I would say the hardest thing was the understanding what was being said to me, because it does take a while to get used to the New Zealand accent and their little idioms. The words that I liked that made me laugh were words like, if somebody said that they were feeling like a box of birds, that means that they're actually feeling quite good. If they say they're feeling crook, that means that they're really feeling poorly and you should pay close attention. Bob's your uncle means that all will be well. Done and dusted means everything's taken care of. So those things were fun, and you just get used to the accent. Driving on the left has its challenges. You'll find that your turning signals will actually turn into windshield wiper controls in New Zealand, and vice versa. Then there's lots of lovely little things you can look forward to enjoying. For me, my experience in New Zealand was absolutely fabulous. I will tell you about the experience I had at the top of a hill in Wellington during the introduction week. There, we took the tram up there. There's a park. There is a stone structure that looks like a square archway. And on one side, it's completely polished gray stone, which is beautiful. But as you walk through it and you look back, that that arch, now the stone is all bright, beautiful colors. And to me, that passing through that was like passing through a threshold from what was wonderful, but what became even more joyful. And that's what I'm hoping for you, is that you might challenge yourself to this wonderful experience and be able to find the joy in being a physician. Best to all of you. Thanks.